Now, in today's episode, I want to talk about stress and how that can have a wide-reaching effect onto our whole body, but then also a more functional medicine approach to it, where we know that our body, how well our body is functioning, if there's inflammation, gut issues, how that can have an effect onto our stress and how well we can deal with therapy, stress management techniques, because we often say that if we have a toxic brain and body, it is really hard to actually be able to do therapy and make changes even though you know you should be doing them. Now, how is that all linked? We'll talk about that today. Now, first of all, just a little regression into biology. You might remember from biology class that we have different types of nervous systems. The one side is the stress, fight or flight nervous system, the sympathetic one, and the other one is the parasympathetic one, the rest, digest, and heal nervous system. And the main nerve there is called vagus nerve. Now, we can only really ever be in one or the other state. That's kind of to kind of really simplify it. And if we are in the fight or flight mode, our body pumps out adrenaline and it eventually pumps out cortisol, and we need all of that to mobilize away from a perceived threat. Let's say there's a tiger that is running behind us. We need a lot of extra energy to run away from the tiger. That is really important. Also, if we have a short-term deadline, then usually that short-term stress on our body, that fight or flight mode, makes us be more productive, work better, focus, and then perform better. But then the important part is that it has to then taper off, and we need to go back into that rest, digest, and heal mode in order for the body not to constantly pump out cortisol and adrenaline, but go back into the rest, digest, and heal mode. Now, when we're in the rest, digest, and heal mode, our vagus nerve can do its thing. It can send signals from the brain into all of our organs, such as our heart, but also our gut, to help our gut digest, help keep the gut healthy, prevent food intolerances, digestive issues, chronic infections. It helps our heart calm down. It helps our kidneys and lungs. Lots of different really important effects. Now, when we are in an acute stress, that is not a problem. If we stay in that stressed out state for too long, that's when we run into issues. Now, normally, if you look at a daily curve in a healthy state, first thing in the morning, we want a nice spike of cortisol that gets us out of bed, gets us motivated, gets our immune system woken up, and everything just firing in all cylinders. And then it should be tapering off throughout the day so that we can then at night have a really nice night's sleep, rest, recover, restore. Now, the problem arises if we pump that cortisol up and then it stays elevated when it should be coming down. So there are different stages of stress where initially we have an acute stressor, goes away, no problem. If we are stressed and then that continues to stay, our cortisol stays elevated for too long, too often, and that's when we start having symptoms. And that's when we start feeling things like being wired but tired, going to bed being exhausted but not being able to sleep because we're just wired, we're ruminating, and we just can't calm down. We feel like we're running away from a tiger. We're also having potentially heart palpitations or sweating, or we're having anxiety attacks, feeling really anxious and nervous, but also our blood pressure goes up. And then more on a systemic level, it can be things like digestive issues. It can mess with our hormones. It can slow down our thyroid so that our metabolism starts to slow down. We start to accumulate fat around the waistline. Even if we're overall skinny, we can start to just keep that layer of fat around the belly. We might also start to have problems with our cycles if we're women and still in our fertile years, that we have PMS or we're missing ovulation, having problems with fertility. It can also drop testosterone for both men and women, and that can then lead to lack of libido or problems building muscle mass. Lots of wide-reaching effects, as you can. Now, some other factors that can show that we're stressed out but we're not in that burnout stage yet is that we can be really hungry all the time, and we are just starving and craving foods that are not that good for us. So when we're really acutely stressed, oftentimes people say, when I just have a short deadline or some stressful presentation, I will not eat and I'm losing weight. But if that then stays on and I'm just stressed out all the time, then all of a sudden just looking at something I gain weight, or I just can't deal with my food cravings and I give in all the time. So that is a really common concern that I see with my patients. And there's actually a biology behind it. Now, we have a prefrontal cortex that helps us make rational decisions. It helps us to make decisions where we look into the future and we can say, okay, well, eating this salad will be good for us in the long term, health-wise. Eating this piece of Cheerios will do this for us, so let's not do that. Now, there's also a part in the back of our brain, in our reptilian brain, called the amygdala, and that is more the survival mode. Now, when we are stressed out, and in particular when we're chronically stressed, then our decision making switches from the prefrontal cortex back into that reptilian part of the brain, into survival mode. And then it becomes really hard to make good decisions on lifestyle and diet choices. For example, if we're being presented with different food choices, we will just eat whatever is there because it's so hard for us to make that decision and not go for the highly palatable foods. Especially, research also shows that we just crave those highly palatable foods, high in sugars, high in carbs, high in fats, because the body thinks that that's what it needs to survive, because it thinks it's under threat and doesn't know when it will next get any kind of energy. Another thing that happens is that when you are chronically stressed out and having high levels of cortisol, we are more prone to wrinkles and also degradation of our joints, bones, and overall tissue and muscle mass as well. Now, reason being is that if we're stressed out, our body, our liver will actually make sugar, and it will pull any of our stored substances, including protein, from our bones, muscles, our collagen in our skin is also made out, that's a type of protein. It will pull all of these protein types and turn it into sugar, something called gluconeogenesis, so that it has energy to run away from this perceived tiger. Now, what that means is that it breaks everything down and that we get brittle, weaker, more wrinkly, older, and have a harder time to make lean muscle mass and just be really healthy and fit and thriving.